Hey everyone, hopefully I can live up to the weight of expectation after the shout out from Ben Goldacre. But yeah, so I'm the rap guy, Sam Hollings, and I'm a principal data scientist. I'm actually a data scientist. So I'm a principal data scientist from NHS England, and I lead our data science rap squad. And I'm here to talk to you today, in case you missed it, about rolling out reproducible analytical pipelines in NHS England. How we did it, and I guess advice to you guys about how you can do it too. Before I dive into all that, I think it's worth introducing you to the wider data science team at NHS England, because we do loads of stuff. Natural language processing, data visualization, obviously RAP, but also we're doing a lot of work on like MPS data linkage, cohort analysis, pair group analysis, visual learning, methodological review, data wrangling of data sets for research. We've got loads going on, and we're going to start publicising our work a lot more shortly. And we've got lots of talks on as well. So I'll show you those later. But yeah, keep an eye out for my colleagues. So today, I'm going to talk to you guys about what the challenges we faced were and why RAP ended up being the solution to those issues. And really, crucially, the four game change, well, how we went about RAP and what four of the game changes for us were that really allowed us to make a lot of progress and I think have some quite good outcomes. And then finally, some take-home points and just how it's going for us. So the challenge. Obviously, our work is about gathering and storing patient data, processing it to make publications, which describe the state of the health service, and then using that to inform policymakers and the public and improve NHS and care systems. So that's like the work of former NHS Digital, NHS England. However, as I'm sure many of you guys will experience in your own places, we've got many different tech stacks. So R, Python, Excel, SAS, SIS, SQL, SSRS, acronyms like nothing else. And lots of manual processes. So people cranking the handle on ancient processes that have been running for a long time. Many of our analysts don't know stuff like Python and gear. And they're just also really busy. They've got a lot going on. And it's not like we've got a couple of analysts. In just the NHS Digital bit of NHS England, you've got like 140 publications and 200 analysts. So there's a lot of people that need help getting out of this situation. And to make it more challenging, there's a lot of siloing. So, some teams are using SAS, some are using SIS, some are using R, whatever. It's hard for them to work together and come up with a solution to all this. They also use different data sets, and there's so many barriers to improving things. So how does RAP address these issues? So by using open source tools like Python and R, automating those manual processes, making reusable components and testing and peer reviewing them so they're really robust, and then sharing our work with the rest of our colleagues and being transparent about how it works and reusing others' work, we can get beyond this. We can help remove the old situation and create a new community working together to improve our analysis and make a body of work that will allow us to have higher quality analysis that's more efficient and robust, that's more standardized and portable, that's more easily understood and easier to maintain and update, and ultimately offers more value. And you can learn more about all this on our website, but I've got a handy QR code at the end to document that. And it's important to say it's not just us. So RAP is really a cross-government effort. We definitely didn't come up with it. And it's in use across the civil service and the NHS. There's hundreds of people in the RAP channel of the Government Data Science Slack, so I sincerely encourage you to go look into that because it's really a great community. And the JSS are talking about RAP. We've got the quality assurance of code for analysis and research guys talking about RAP. The government's blogging about RAP. The Goldacre review, as you heard about earlier, talks about RAP a great deal. RAP should be the minimum standard for academic and NHS data analysis. Reproducible analytical pipelines is the core working practice that must be supported by all platforms and teams. We should use RAP principles for data curation, and we should share all publicly funded data curation code. Researchers should be using RAP, and we're the ones that should be training them. and data control should require wrap and open code sharing from data users, and the TREs, so the platforms in which we use this data, themselves should be built on the principles of wrap and open code. And we've even got MPs asking each other about wrap. So this one MP said, you know, how are you guys doing wrap? And the government response was, we're doing wrap in these ways. So yeah, it's important, and it's something that I think that we should all get involved in. And, you know, so what? Like, what's the point? Well, we've been working with our analysts to help improve their pipelines, and I really like this quote, which is, one of our analysts said that work that took them 2 weeks to do because they had quite a manual pipeline that I'll describe more a bit later, now it runs in 40 minutes. So that's a really extreme example of perhaps a really, really huge reduction in burden, but, you know, it shows what's possible, I guess. So, before I get to those 4 game-changing things, the sort of pre-game changer was having a central wrap squad. So as I said before, we had all this complicated set of technical stuff like Excel, SAS, Sys, Python, R. We had all these manual processes people were cranking their hands on, and we had a lot of siloed work. So how do you get around this? Well, you sort of have to create a team that's extracted from all this. So a bunch of the data scientists were tasked with basically trying to get a holistic view of what was going on so that they could then work on best practice that was, because there's a lot of best practice out there, but best practice, like reinterpreting that best practice to make it really relevant for our systems and our teams, you know, make training materials specific to our analysts and the tools they're using, the limitations of our systems. And to just be a point of help for our analysts, because, you know, any change program, people get stuck, they need someone to turn to. And then finally, and this is one of the parts I love the most, is to champion wrap. So to not only just go out there to my colleagues and say, this is awesome, you know, it can help you in all these ways, but when they've done something great, when they've made a big transformation, really saved a lot of time, to really shout about their great work and celebrate it and make sure that people hear about it. And that's one of my favorite parts, to just really sort of celebrate the work of my colleagues. And yeah. And so the 4 game changes I mentioned, which the wrap squad really sort of focused on, was first breaking wrap into chunks and making it achievable. And I'll explain more about that in a second. Getting the big picture on wrap in the organization. It's fine having a plan for what wrap is, but if you don't really know what's happening in the organization, it can be hard to know where to target, where to hit with your resource. The thin slice process, which is came up with by my colleagues, and it really is a sort of a roadmap for how to transform a pipeline and rapidify it, and to train others how to do that. And then finally, just publicizing wrap, you know, talking about it a lot and making sure people hear about it. So yeah, first of these, breaking wrap into chunks. So wrap can seem like this massive mountain. Like I'll tell you more about that's what it involves, but you know, if you start off with a big manual process that involves lots of steps and manual blah 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 blah, it can seem impossible to how do I even start trying to change that? And also at the bottom of the mountain, it can seem very comfortable. You know, like climbing that mountain is a lot of effort. So the government wrap strategy, which I should have given a link to it, is really good. So definitely search those words, because it's a great website. But government wrap strategy sets out wrap as all these things. So a wrap must, you know, use open source language, code version control, publishing the code, link the code to the repository, document it. And then there's all this further development stuff. So code's fully automated, well tested, and blah blah blah. And this is fine. However, we actually found that despite how simple this looks, people find it hard to prioritize sometimes. And they were asking us, like, what's the minimum we can do to have achieved something? Like, so we tweaked it slightly to make the minimum even easier. Like, and so the baseline wrap of, you know, open source, just using open source, code version control, publishing the code in the open, and the publication should link to the code repository. Like, And we haven't really totally removed this well-documented part. Like, we still expect some level of documentation, but we think it was almost more important they just get this stuff out there than to hold off until they have lots of documentation. Because even just doing this, you get so many of the benefits of that, which is, automation and not using expensive licensed software, and people being able to see your stuff, transparency, and reuse it. And then we created another level, sort of silver wrap, that is about making the code more robust and reusable. And we expect a lot of people to go into this, so having it clearly marked out helps. And then finally, gold wrap, which honestly we don't expect most of our analysts to do unless it's a pipeline that runs very, very regularly. But it's good that they knew that, and they knew, okay, we don't have to worry about that for now at least. And this is really making analysis of the software product, so CI/CD and fully packaging and environment management the piece of work, and happy to talk more about any of these and why we, if you disagree as well. But that's how we sort of did it. Next, the wrap big picture. So I'm trying to remember what this picture was all about. But basically, when you start doing wrap in your organization, you'll find you've got a lot of wrap work already going on, because the big secret revealed, wrap is just a word that's been existed for a long time, which is like good practice. So DevOps, general analytical good practice, the code of practice for stats, they all talk about this sort of stuff. And so you'll find that people have been doing this stuff already in various ways. And you'll even have teams that are just popping up and choosing to do it themselves, because they read on the I don't know, might have gone out and read the Goldacre review or something like that. Or they might have seen me posting on LinkedIn about it or something. But like this jumble of balls, it can become quite hard to keep track of. And then you might end up, not helping the right people, basically. And also, I guess, as I'm going to say here, you might not know what systems you've got and what they're capable of. So, it's really useful to think about the big picture wrap in your organization and to audit your systems first and your analytical environments, and think about, to what extent is it possible to do that? What are the blockers? Can they be resolved and worked around? And to engage with stakeholders like IT and information governance, cyber, because honestly, they're not always that keen on sharing code publicly. But we need to talk them around, or it's something we need to do for various reasons. And then, crucially, it's really important that we actually talk to all of our sort of analytical product owners and understand the maturity of their work. So here I've got a cartoon of a sort of maturity matrix, and we've got all the different analytical pipelines here, and the owners of those. And you can see that we've worked out to what extent they've met baseline wrap, but you could also do it for silver and gold. And you can see that obviously Alice is doing great. She's got open code, she's using Git version control, they're peer reviewing it, it's all published, that's wonderful. But you might find, Carl is obviously struggling a bit. He might be using SAS or something like that, he doesn't even have a clue what Git is, or even where to start. And so this was a real game changer for us, just literally making a spreadsheet of the status of all our 140 pipelines and who was stuck where and who was doing fine. Really helped in targeting our resources where they can make the most impact. It sounds sort of obvious, but it's something that we didn't do at the start, and that I wish we hadn't. And then we've also got the thin slice. So that's basically, we've broken up into chunks to make it more achievable. We have the big picture of really who needs help and to what extent they can be helped given the systems and limitations and the rest of it. But then how do we actually go about transforming their work, now that we've targeted who needs help, and how they actually do that? So I think it's nice to sort of first lay out how my team sort of works. So we work in these roughly 2-month cycles where generally we just all the time have drop-in sessions or open door sessions. People can just come in every Thursday from 10 to 11, can come in onto, me and my team just sit on a Teams call and people can join, ask for help, whatever. Like, so we always do that for pretty much anybody that wants to join in our organization. But then we also have these engagements that basically we spend more time, basically all of our time, with some analysts, helping them transform their pipeline. And the aim isn't to transform it for them and to hand back something, but it's to teach them how to transform it and to help them do it. And so this is following this thin slice process, and we'll scale the number of these based on the amount of people I have working for me, because that changes. Like sometimes some of my guys get moved onto the projects or whatever, depending on business need. But yeah. So what is a thin slice process? It's, well, unfortunately not as cake-based as I'd like, but basically, like a cake is obviously very difficult to see what's going on, but a slice is a lot easier to understand, I guess, because you can see what's happening, end to end. And in the same way, we're going to take the old process and we'll transform that, but we'll take one part of the old process end to end. So in some publication where they work out, say, stats about GP appointments, we'll transform one part of the old process, just the national count of GP appointments, and we'll make that in Python and Git end to end. So it takes the old data in, gives the old output out. And we'll make sure that is fully tested and works and in good practice. And I guess depending on the team, if they're quite good at Python and stuff, we'll let them do that. But if they're maybe not, then maybe my team will do that. And then the next part is really about a bit of back and forth with them to make sure they understand how it works and why we've done things a certain way, or if they made it, review it and help them improve it until it meets our community's definition of what good looks like. So helping them iterate the thin slice until it looks good, and that they understand it and that they're confident in it. And then the next most exciting part is where my team steps back really, and tells the analysts to try and expand that thin slice to cover the rest of the publication. So rather than the All England figure of GP appointments, they might start looking at different breakdowns, so by CCG or by trust, and then other things, not just GP appointments, but missed appointments or whatever. And yeah, so the analysts have a go at that, and obviously they'll have a go, they'll make mistakes, they'll fall down, we'll help them up, we'll do some peer review. But by the end of the 2 months, often they're just doing it themselves. They're peer reviewing each other's work, and then we can sail off into the sunset, and they can continue and continue to train each other and get better. And the reason why I think this is really good is because they're learning on something they understand. It's their work. They have the old pipeline there, and they're seeing it rewritten in a new way. And crucially, they're seeing the application of what they're taught. So there's a lot of just-in-time learning. So we're not just saying, go on a Python course, and then a week later, okay, now use Python. We're saying, okay, the first part of your pipeline is to load the data. Here's how that's done in Python. So they're seeing the application immediately of what they've been taught. The code base remains small because the thin slice is relatively small. So that means it's less overwhelming. They can feasibly look at the whole code base and understand it. And then there's a lot of people can end up sort of afraid of looking in folders because they're not sure what it contains. Keeping it small doesn't make it easy for people to then have ownership of it, because they've seen it grow up from the ground up, and so they feel like they've been a part of the whole thing. That's why I think the thin slice process works really, really well. And we have guidance about this on our website, so you don't have to remember all of this. And so how have we applied RAP in practice really? So some sort of examples. So we had a team that had a SAS process, and we helped them remake that into using Python, specifically PySpark. And that was all about moving to open source and version control. That was what we really wanted them to get out of it. We had another team where they had a very manual and SQL-based process, and we helped them change all that into sort of Python running the SQL. So using Python to automate the manual steps and to run the SQL in sequence to ensure they got as much bang for their buck as possible. And I'll expand on this example in a few moments. And then we've even worked with teams that already have Python processes. yeah, so for them, it was really about focusing on functionalizing version control their existing code and punching through barriers to automation. And so yeah, Rap's flexible, it's not one size fits all. And you can see that here's an example of that thing I mentioned earlier, how we've got a process where they had a bunch of manual SQL, they run each script by hand, and they pull the data out, and they make some files and make some CSVs, and they're running lots of scripts manually. So basically, we just use Python to automate that manual stuff and let the SQL script to learn. And that's easier for the analysts to learn. They feel like their work still has value from before, and yet they're gaining the benefit. And even better, later on, when they want to, they can change that SQL into Python and then take it further, which has got a lot of benefits as well. And so, yeah, finally, publicizing RAP. So like I said, we had these drop-in sessions, we asked questions, shared progress, we had monthly seminars with interesting speakers, and we went to these cross-government RAP events. But it can sometimes be a bit of an echo chamber unless you really, really try and reach out, because you talk to the same sorts of people again and again. But we really need to reach everybody. And so we did a lot of work on promoting RAP. So we had weekly and monthly events that we tried to tell everybody about. We tried to post out on our internal forums. We got slots on our directorate-wide briefings so people couldn't really avoid us. And we even spoke to the graduates in their first week in the organisation to give them a sort of a workshop on RAP. Basically, any chance we got. And we focused on selling the benefits to the organisation, but also to individuals, and making it relevant to their work and a solution to their problems that they were having. And obviously, the goal data review really helped because it brought it into the conversation. But it was also really crucial that we aimed at all levels, so not just the analysts, but directors, heads, managers, and having a senior active sponsor really helps. And in the spirit of plugging our resources, here's a bunch of links from our website. Yes, we've got our website where we update that quite often with new guides and stuff on RAP and all the rest of it. And we've got a really good, useful links page with lots of other great websites like, the NHS and the Duckbook, and yeah, we also post on LinkedIn a lot, so have a look at that. So the take-home points. I really like the idea of running a central RAP squad, because having someone people can go to is really helpful. Get an overview of how things are going in your business, like what blockers there are, what opportunities there are, and how people are doing maturity-wise. Make RAP achievable, so a thin slice, levels of RAP, and promote RAP, and crucially, the amazing work of your colleagues. And so, yeah, how's it going for us? We've got analytical tribes that are engaged in planning RAP, senior leadership take RAP seriously. Our analysts feel valued and understand the benefit of RAP to them, which is really good. We've got 15 publication pipelines that are published in the open, but 27 more that are well on the way and that are hopefully getting published soon. RAP still sprinkled across the analytical teams, and we've got loads of pages of guidance on our website, and hopefully we'll have more soon. And yeah, so before I finish, I thought I'd highlight a lot of the awesome talks of my colleagues. So, tomorrow we've got talks from loads of my colleagues, on things ranging from, ambulance performance improvement strategies, right through to synthetic data, and we've also got a side room that you should check out, where we're going to talk about PhD internships, RAP drop-ins, and we've got a bunch of posters as well that you should have a look at. There's loads of great work from the NHS England data science team, and definitely have a look at it. And yeah, I just want to thank people in my team right now. So Joe, Alistair, Hamera, Warren, but also all the previous members who were completely instrumental in making this happen, particularly Connor and Colin. And thanks.